Today we have a guest, Dr. Keely Hirsch, who will be helping to undercomplicate the topic of autism and ASD. Welcome to Undercomplicating Stuff, where we, two psychologists and coaches with over 40 years of combined experience, share our insights to help undercomplicate important topics. A friendly reminder that this video is meant for conversational and entertainment purposes only. Please see the information section of this video for additional resources. So I'm Dr. Julie Radico. I'm a psychologist, a coach, an author, and a speaker. And I'm here with Dr. Stacey Gideon.
Hi, I'm Stacey Gideon. I'm a health psychologist and the founder and CEO of a healthcare consulting and professional coaching business. And Dr. Hirsch, please introduce yourself.
Great. Hi, I'm Keely, and I'm a psychologist at Penn State Health in the Department of Psychiatry and Behavioral Health, specifically in the Division of Autism Services.
Thank you so much for being here. And we know that this is a really big topic and appreciate that you're going to help our listeners understand it a little bit better. And also knowing that we can't possibly cover every element of autism and ASD, but we're hoping you could start with a basic sort of definition, signs, symptoms. What is meant by autism or ASD?
So autism is kind of a trendy diagnosis these days. A lot of people talk about it on social media. It's getting a lot of attention, which is wonderful. But I think sometimes we're not fully getting a great sense of what autism is. So I'm glad that we're talking about it today. So to start off, autism is a neurodevelopmental disorder. So the first part of that is neuro, which refers to the brain, and developmental refers to the early stages of life. The neurodevelopmental disorders are usually differences in brains and brain functioning that we can see in the early parts of childhood, so usually before the age of 5. Autism itself is a very complex disorder, and each person that has a diagnosis of autism is very unique. There is no one singular way that autism looks. So we like to say in the world of autism, if you've met one person with autism, you've met one person with autism, because each presentation profile of autism a person has is very unique. But the diagnosis of autism, there's two kind of main aspects of it. So the one main aspect is challenges or difficulties or differences in social communication. So this can be difficulties with being able to engage in conversations or pick up on social cues or people's nonverbal cues like body language, or being able to use a lot of nonverbal cues yourself, like expressing a lot of emotion or feeling comfortable with eye contact. It can also be challenges with developing and maintaining friendship. So that's kind of the social communication aspect of autism. The other aspect is referred to as restricted and repetitive behaviors. So these can be things like repetitive body movements and repetitive vocalizations or repetitive sayings or words or noises people make. It can also be having a really strong interest in something. So very fixated interest that's all the person loves doing and spending their time engaging with or researching or watching. It can be sensory sensitivities. So sensitivities to sound or light, smells, touch, clothing, or hyposensitivities, not feeling a lot of those things, needing more sensory input, like needing a lot of flavor in food to taste it, or wanting deep pressure squeezes or hugs to feel a little bit more. And there can also be in this bubble of restricted repetitive behaviors, this insistence or need for sameness. So being able to predict what's going to happen. So any kind of changes in a typical routine or anything unexpected that pop up can cause a little bit of distress and discomfort for individuals. Being able to really anticipate and know what's going to happen or being able to control a lot of their life is another aspect. So those are the two main areas, the social communication aspect and then the restricted repetitive behaviors.
So it sounds like from what you're saying that there's a whole lot of complexity that exists around this diagnosis, and somebody who might be autistic, that they might look very unique from somebody else who also might be autistic. If you could share with us, because I'm really mindful as I use this language, how do you identify or figure out like how somebody who is autistic might want to be addressed in this realm? Because my understanding is that as psychologists, we're taught very much like person first language, that it's a person with autistic, traits or somebody with ASD. And from my own education, I've learned that that might not be the case of how people want to be addressed if they are autistic. And so can you just shed some light on people who are listening? Like, how do they navigate that in a really thoughtful way?
Yeah, and I think you're totally right. I think as like mental health professionals, we are really encouraged and taught to use more of that person first language. So my cousin has autism, or I have autism. I don't personally have autism, but just giving that example. But the way that an individual with autism or an autism diagnosis identifies themselves is going to be very unique to that person. So it's always important to kind of check with that person. But interestingly, there's been a lot of like polls on social media and an actual research study that came out within the past few years examining what people with the diagnosis of autism prefer in terms of how people refer to them. And so in this study, they looked at like 700 people with the diagnosis of autism and asked if they preferred that person first language of person with autism or identity first language. So I'm an autistic person. This is my autistic cousin. And the vast majority of the people that they polled, of the self-advocates or individuals with autism, preferred that identity first language. I think it was something like 85% of the individuals preferred I'm an autistic person versus I'm a person with autism. We want to use the language that the majority of the community, the autistic community, is preferring. So, I think a go-to is to try and switch to that identity first language of autistic person. But again, every person is going to be particular and unique about what they prefer. So it's always good to ask. I have a little anecdote. A person I was working with, usually when I start working with the person, I'll ask them, like, tell me a little bit about how you like view your autism or your diagnosis of autism. And he was like, well, I was diagnosed when I was really young. And so it just feels like it's a part of my body. It's like just my arm. So like I just see it as a part of me. But when I refer to like myself or my autism, he said, I think of it as like, oh, well, my autism makes it harder for me to do this. So it's kind of a in between of like an identity and aspect of himself, but also seeing it as like something that he's different in a way, and it makes him engage in the world a little bit differently. So everyone is unique. Everyone is different. If you're trying to decide like how to refer to individuals in this community, I think the identity first autistic person is probably the preferred, but again, always good to check with someone.
Thank you for highlighting the importance of really person-centered discussions in terms of what people prefer and how they identify. I think that's always helpful, really in any topic that we're talking about. And it also makes me think in terms of identification, it seems as if the prevalence of autism has increased over the years. And I've heard about it in the news, in our training, we hear things about this. You seem like you talk to people more that know someone that is experiencing this. And I wonder if you could speak a little bit to, is it increasing? And if so, what might be factors related to that?
Just to give a sense of like this increase in the rise of autism. So in 2000, the CDC reported that autism occurs in about 1 in 150 children. Now, 26 years later, in 2026, CDC, their report indicated that about 1 in 36 children have a diagnosis of autism. So we went from 1 in 150 to 1 in 36, which feels like a really huge jump, which it can be. But I think there's a lot of actually really awesome reasons why that change in prevalence has actually occurred. I know a lot of people worry about this idea of an autism epidemic, but I think it's, like I said, I think there's some really great things that have happened for why the prevalence rate has changed. So I think the first thing is just awareness of autism. I think there's been a huge movement in autism in media and social media and understanding it and getting a better representation of what autism is. And that keeps changing over the years. So we're getting more awareness of this diagnosis. And the more awareness means more education people have, more identification. So the more we know about it, the more we look into it. So I think that's the first thing. And I think that's a great thing that there's more awareness. Also, in 2013, so the Diagnostic and Statistical Manual, which is kind of like the big book for psychiatric disorders that have all the different diagnoses and the criteria for them for mental health and psychiatric disorders, they changed their criteria for autism. So before 2013, there were 4 different diagnoses that made up the diagnosis of like autism spectrum disorders. So, one of them was called Asperger's syndrome. Another one was autistic disorder. And then there were 2 other ones, pervasive developmental disorder and childhood disintegrative disorder. But in 2013, instead of having these 4 different diagnoses, they lumped them all into one diagnosis, which they refer to as autism spectrum disorder. And when they did this, it cast a wider net of how we define autism. So the criteria before 2013 was a lot more narrow. So to get a diagnosis of Asperger's syndrome or autistic disorder, it was very, very specific. And now with autism spectrum disorder, after this 2013 shift, we've widened how we view it. And so we're capturing a lot more people. We're capturing a lot more people on the more, I hate to use the term mild, but less intensive symptoms, less supportive needs individuals. So mild presentation. So we've been able to widen our definition. And I think that's been a huge thing. Another thing is we are getting really, really good at identifying autism early on. So pediatrician offices are doing screenings at I think it's 12 months and then 18 months and just constantly looking for those. So they're able to screen and identify any potential markers or traits of autism to ensure that the individual might have a little bit more support in the things that they need, or at least to have awareness that, oh, it seems like, maybe they're leading down this road of autism, just something to be aware of, just helping to support their neurodivergent brain. Having that already in place, getting a lot more ways to identify people has been one. And then the last reason is we're getting really good with our assessment tools and diagnosing. So we've got a lot of screeners out there. We've got a lot of different ways to identify autism in testing. And we're getting really specific and good at it. I think the combination of awareness, early identification, the change in our diagnostic criteria, and the better tools that we have to diagnose autism is basically what is helping us increase the rate. So it's not necessarily a bad thing. It just means that we're able to, again, cast that wide net and identify people earlier on and with a wider range of symptoms.
As you talk about the evolution of the diagnosis, I'm mindful that I was trained on diagnosing people with Asperger's. And I'm wondering if you could share with us how this has continued to evolve and how people should be thinking about or considering autism.
Yeah, I'm really glad you asked that because I think the community we're definitely gravitating away from the use of Asperger's syndrome or high versus low functioning. I think that was a big thing that we're really trying not to use. And just to go into that a little bit more, it could be really derogatory or demeaning to call somebody low functioning. Like if someone said, oh, they're low functioning, that's not right. And it makes it very binary. Either they're high or they're low. And functioning is a spectrum. There's so many ways that people can function. I know I do well functioning with completing my daily tasks and getting my work done and keeping up with all my chores and taking care of my kids. But in terms of my self-care or engaging in my hobbies, I struggle with that. So does that mean that I'm high functioning or low functioning? So I think we're really trying to avoid that high or low functioning term and even gravitating away from Asperger's syndrome. Since we are gravitating away from the high versus low functioning, people or using the term Asperger's syndrome, people are having a hard time being able to describe where someone might fall on the autism spectrum. So, if I said I have an autistic cousin, no one might necessarily know what that means. Does that mean that they are again, more mild in their presentation, that they're able to socialize and do more things independently and maintain a job? Or is my cousin more on the more severe end where he needs a lot of support? We would never know. So the way that we're being able to differentiate where people fall on the spectrum actually came from that change in 2013. In 2013, in our Diagnostic and Statistical Manual, they added these things called levels of support. And these basically indicate how much support a person with autism might need. So there's 3 levels: level 1, level 2, and level 3. And the simplest way to remember it, again, I'm trying to move away from mild, moderate, or severe, but the simplest way to try and remember it is level 1 is a more mild presentation, level 2 is a more moderate presentation, and level 3 is a more severe presentation. So people with level 1 might be people that you can't tell that they have autism. They've learned a lot of tools to mask, or they have a lot of strengths in their social skills or reading nonverbal cues, or they don't present with a lot of outward behaviors. They don't present with a lot of repetitive actions or things like that. So we might not be able to recognize them as autistic if they have level 1, but certainly some level 1 autistic individuals you can. Level 2 is more, you could probably tell right off the bat that there's something a little bit different about them, either in their social communication approach or or maybe some of the behaviors that they're doing outwardly, you can tell kind of right away, like, okay, they're different. They are probably a neurodivergent person. And then level 3 are the most severe, who need that round the clock support, like need maybe an aide with them 24/7. These individuals might not have language or be speaking. Maybe they're communicating with more vocalizations like sounds or pointing at things or using like an iPad to communicate. And these individuals might have more challenges with like maintaining their own safety, like maybe harming themselves by hitting their head on the wall or like becoming aggressive with others. They might also not have those issues at all too, but usually these individuals need the most support in terms of their daily life and living. So usually being able to indicate how much support a person needs is the best way to kind of identify. So you can say, oh yeah, I'm an autistic person with like low support needs, which means like maybe that level 1 or level 2, or they're an autistic person with high support needs. So indicating maybe level 3. So that's kind of where we're moving towards in terms of defining individuals and how much support they need versus their functioning level.
I think that'd be great to do that for all the disorders. So
Definitely.
much less stigma, to refer to it that way. And then it makes me think about, I would imagine that different levels, different folks, even within the levels, require or do better with different types of treatment. Can you speak a little bit to the different types of treatment that are available, as well as maybe what people should look for to know that they're connected to the right person or people and resources?
Each autistic person is going to have very unique needs. They might need more support. They might not need support in their everyday life, but there's a lot of variability in the different levels of supports people might usually need. So like the way I would break it down in the most simple way is talking about the treatments and supports at each level. For level 1, again, that like more mild presentation, supports that they might need are maybe like accommodations at school, maybe if they need like more breaks or if they need a little bit more learning support or things like that, they might benefit from that. In their work environment, being able to have more flexibility with like some of the tasks that they're doing, or accommodations like being able to wear like earbuds or sunglasses to like reduce sensory input can be helpful. But in terms of mental health support, usually level 1 benefit mostly from therapy, and therapy mostly addresses their co-occurring disorders, mostly like any kind of anxiety or depression, working on those and how they fit within the individual's autistic presentation, medication management, depending on the person's need. For level 2, we're going to see a little bit more support. They might have behavioral health support. So someone coming into the school, so if they're a child under the age of 18, maybe they have like a support that comes into the school with them for a couple hours a day and helps them with their interactions, managing their emotions or communicating or things like that, or being able to organize their task and function, or working on skills at home with them. So teaching them ways to manage their emotions or working on social skills and things like that at home. These individuals might also benefit from therapy and medication management. They might also have community supports and resources. So having an independent support living person coming into their home and teaching them skills like how to do laundry, how to cook, how to communicate in the community, like how to talk to the bank teller or how to communicate with the person at the grocery store and how to ask for things. So giving them a little bit more life lessons on how to function a little bit more independently. And then level 3, they're going to benefit mostly from those, like I mentioned, like round the clock services of like having someone there with them, helping them have their needs met, maybe helping them with going to the bathroom or helping them like engage in an enjoyable activity or going out with them in the community and helping them like go grocery shopping or things like that. So different support needs, different treatment needs for the different levels.
Again, this just reinforces how individualized and important it is to figure out what that autistic person needs on a one-on-one basis. That there's a whole toolbox of potential tools to help somebody, and you have to have really thoughtful conversations with them or their care team to figure out what fits best for them. With all of that clear nuance that is in this space, I'm wondering if you could share with us what are some of the like myths or misconceptions that you would really hope people would recognize, or maybe misinformation that's out there?
Yeah, so I will talk about probably the most recent myth or curiosity going on, which is what's causing autism. I know, there's been a lot of speculation of Tylenol taken during pregnancy causing autism, or the vaccine concern, childhood vaccinations causing autism. So I'll address this one first because I think it's usually the biggest myth or misconception people have. So I want to make this very clear. So vaccines do not cause autism. The reason that came about was in 1998, there was a physician who was doing a research study seeing if vaccinations led to symptoms or the cause of autism. What we found out was that he completely falsified the data. He made everything up, and he was like colluding with an insurance company. So it was not true at all. And there has been hundreds of replication studies, and none of them have found any link between autism and vaccines. So I think that is really, really important to know. The whole thing with Tylenol. So I think it's important to differentiate cause versus correlation. So Tylenol does not cause autism, but taking Tylenol during pregnancy might increase the risk of the child developing autism. But there's so many other things that there's so many other studies that say, oh, this could increase the risk of autism. So for instance, there was a study that said not enough sunlight can cause autism. So children in the Northeast, where it's raining a lot more, the Pacific Northwest, where it's raining and they're not getting outside as much, they have higher rates of autism. But then there's other studies that say too much sunlight causes autism. So children in Somalia who have way too much sunlight have higher rates of autism. Then there's other things that talk about like drinking a diet soda during pregnancy every day, like increases the risk of autism. So we just really don't know what's causing it. We can say like maybe it increases the risk, but it's not necessarily going to cause it. So I think that's one thing to recognize, that vaccines, Tylenol, do not cause autism. Vaccines do not increase the risk of autism. Maybe Tylenol slightly increases the risk. We really don't know. I think that's an important misconception and myth to be aware of. Another big myth about autism is that all autistic people are either geniuses, or they refer to as savants, or they have very low intellectual abilities. So the reality is that autism spans a wide range of intellectual abilities. So some autistic individuals might have extraordinary skills in a specific area, which we've referred to as savant syndrome. So this could be hearing a song and being able to instantly play it on the piano, or being able to have someone say, draw me this, and being able to draw it, or like from the movie Rain Man, being able to count how many cards or toothpicks or whatever it was fell on the floor, being able to figure that out. Not all autistic people have this savant syndrome. And on the other side, not all autistic people have low intellectual abilities or intellectual disability. For the most part, people with autism are falling into the average or maybe slightly above average IQ levels. So I think that's an important thing to remember. Another myth and misconception is that autistic people don't have any empathy or they don't have emotions. And the reality is autistic people can be some of the most empathic people ever. They can be highly aware of the concerns or emotions or needs of others, but they might just struggle with how to convey it, or they might not necessarily pick up on those cues all the time. When someone is having a difficult time, they might not necessarily pick up on it. But they do have empathy, and they definitely can and will show emotion. It just might not be in what we typically think of. So people with autism might not show a full range of facial expressions. Like they might not be like smiling or happy or like angry looking or sad. They might just have kind of a blank face. And this isn't all autistic people. This is just, again, maybe some autistic people, but that doesn't mean they don't have emotions. They might just not be showing it in a way that people would be able to recognize. And then the last myth that I want to comment on is that people feel that autistic individuals are not social, or they're not interested in having friends or romantic relationships. But the reality is that many autistic people want friends and have friends and want romantic relationships and are married or have a partner. I think it's just that's been kind of the stereotype of autism, that they just don't want any friends, or maybe it's just the kid that likes playing by themselves in the corner, and that's kind of the image people think of autism. But the reality is they can have friends, they do have friends, they want friends. That's not all people with autism. Some people with autism are perfectly happy just doing their own thing by themselves, and that's great. I think that's another important thing, that autistic people do have social interests and can have friends and relationships.
Thank you for sharing all of this information. I feel like we just scratched the surface, and in particular to all the myth busting that you're doing, which is incredibly helpful. Again, I think to decrease the stigma and to increase awareness and acceptance that this is across a range. And related to that, my takeaway is something you said early on. So I'm going to quote you. If you've met one autistic person, you've met one autistic person. And I think it's so important to keep that in mind.
Exactly, exactly.
Stacy, you took the words out of my mouth. My key takeaway is from all of this, there's so much nuance here in how somebody might get diagnosed as autistic and what they might look like and what supports they might need. And just the fact that you meet one person who is autistic, you met one person who is autistic, and really making space to have conversations with individuals and figure out how can I best support you as somebody who wants to be their friend, as somebody who might be in a caregiver role, as somebody who is a professional treating them, whatever it might be, not to make assumptions or put people into boxes that then is somehow like writing them off in a way that is really doing a disservice to everyone, that person themselves, but everyone around them and their community. So I really appreciate all of the information that you have shared. And I wonder what might be a key takeaway that you would hope people would carry with them.
So one of the things I'm really trying to make a big push and plug for is being neurodivergent affirming. And a big challenge that happens these days are people expect autistic or neurodivergent people to match what's expected in a neurotypical world. So trying to conform to what neurotypical, what like the social expectations are. But I think as a society, we need to do better of trying to changing ourselves as neurotypical people to be more neurodivergent affirming, and being able to recognize that there are differences. So instead of making neurodivergent people try and fit into our mold, us being more open to what their mold looks like. So the biggest thing that I work on with my therapy patients is, how do I help you be as comfortable and as authentic of yourself as a neurodivergent person in a neurotypical world? If you are happy not having like friends, and you are happy like doing your own interest and having your alone time, like great. And don't let anyone force you to feel like you have to have friends or make you have friends. You can do that. Or if you have a self-soothing thing that you like to do that's not necessarily harming you or someone else, like then why is it a problem for you to do that in public? So, like, for instance, I think everyone has some kind of motor stim or repetitive action that we all do. I know for myself, I'm like sitting here rubbing my nails. It's just something we all do. Some people shake their legs, some people fidget with their fingers, some people pull out their hair. It's okay. Like, that's not hurting anyone. And I think it's okay to do those things if they make you feel comfortable. So I think the world needs to change and be more open to neurodiversity and neurodivergent individuals.
That was so well said, that we need to create a world in which people are able to be themselves and feel welcomed and safe, and that there's so much that's lost by trying to fit every single person into the same square peg of neurotypicality. We lose so much. And so I really appreciate your wisdom and your time. And I know that listeners have learned so much from all of what you shared today. And so if this topic resonated with you as you've listened, please share it with somebody that you care about. You can also find resources from our discussion today in the description of this video. Also, please comment, like, and subscribe. You can listen to our podcast on YouTube, Spotify, and Apple. You can also message us on YouTube, Facebook, or LinkedIn with suggestions of questions you'd like us to talk about in future episodes.